So what about the progression? So early on, so you may have normal vision, and initially, as the transparency starts to go, you'll start to lose contours of objects. So it'll be harder to distinguish like rough edges of objects, as well as contrast sensitivity. So you won't be able to distinguish between how intense light is on certain areas, like a picture, or if a lighted scene, if something's extremely bright versus something's not so bright, you won't be able to tell the difference. Glare, you'll start to notice glare early on, and that's primarily in the daytime. And as we talked about, myopic shifts going from farsightedness to nearsightedness, that of course being occurring with posterior subcapsular cataracts very commonly, is another issue you'll see early on. And then late, the symptoms that you see with late progression are primarily just very bad progression of all of these. So worsened contrast sensitivity, lots of glare all the time, and pretty significant nearsightedness. If you let this go without therapy, it can turn into mature cataracts in which they occlude practically all your vision and lead to blindness, or hypermature, where we actually get liquefaction of the lens structure. The issue with this is it can actually leak into the lens capsule, right, and cause a lot of inflammation and long-term blindness. So this is something that's very, very rare to see in the US, but unfortunately occurs very commonly in third world countries, unfortunately, with a lack of medical care.